I'm Dr. Andrew Hubbard. I'm a naturopathic doctor, and I wanted to spend a few moments today talking about a condition I see very often, and that's irritable bowel syndrome, or IBS. You may have been diagnosed with IBS. It's very prevalent. It happens in approximately 15% of the population, which is a ton of people. And IBS is a functional gastrointestinal disorder, which means that it is a disorder that is diagnosed after other disease conditions are considered. Things like peptic ulcer disease, celiac, Crohn's, colitis. So really, it's diagnosed after somebody's had all the typical testing done, yet they still have digestive symptoms. And so what I commonly see is this kind of catch-all diagnosis of, well, you have abdominal pain, you have cramping, you have these symptoms, so it must be IBS. And what I've learned is that oftentimes that type of diagnosis can be harmful to somebody, and it certainly isn't all that helpful to a lot of people. Maybe you can relate. And so when IBS is diagnosed, sometimes it's not actually IBS, and that's kind of where I come in. And doing a really thorough intake is important when considering the symptoms. And there are other conditions, other functional gastrointestinal disorders that should be considered. One of them that I see commonly is something called functional dyspepsia, and this is kind of when you have you eat a meal and you have to stop eating your meal because you feel so full, right? And oftentimes it leads to people eating smaller meals. You may get the sensation of bloating right after you eat, or a burning sensation in your upper abdomen. And you may actually have pain, right? And so a lot of people who have functional dyspepsia actually, or sorry, who are diagnosed with IBS will actually have functional dyspepsia. And so it's really important to consider other conditions when you get labeled as having IBS. And so if you fit in that camp and you feel like you've been slapped that label and you want to do a little bit more investigation, then we should talk.